We are honored to be joined by Luisa Charbonneau, who is CEO of Braven Health. Good to have you with us.
Hi, Steve. Nice to be here. Thanks.
For those who do not know, when Braven was announced, it's a collaboration of Horizon Blue Cross Blue Shield New Jersey, Hackensack Meridian Health, and RWJBarnabas Health. Pretty unique collaboration. What is it, and why does it matter so much?
So it is the first and only jointly owned and operated Medicare Advantage plan in the state of New Jersey between those three fine institutions. And it really is all about creating one of the best types of Medicare Advantage plans you can have, full collaboration between the health systems and the health insurer.
And by the way, all of those entities happen to be supporters of what we do. To disclose. But Luis, let me ask you this. The term Medicare and then Medicare Advantage is used. And one of the things I've learned in doing healthcare programming is that the assumption that people know what this means, that means, what's the difference between Medicare and Medicare Advantage?
So Medicare is the program that's, many people call it original Medicare. It's the program that is operated by the government, by the Centers for Medicare and Medicaid Services.
Right. That's the, what is that acronym again?
CMS.
CMS. Thank you very much.
Right.
I apologize.
Yeah. And no. And Medicare Advantage is a plan where the government contracts with a variety of health insurers to offer, private health insurers to offer additional benefits in addition to what Medicare covers.
So what population is most directly impacted by Braven being established and then being in the marketplace?
So the senior population in our 8-county service area in New Jersey, anybody who's eligible for Medicare, either by way of age or disability.
Let me follow up on this. COVID has impacted the older community. And by the way, I just want to clarify, Braven is in the 8 counties, is Bergen, Essex. That's why I have our team here. Bergen, Essex, Hudson, Middlesex, Monmouth, Ocean, Passaic, and Union. Thank you so much, team. Appreciate that. Lisa, let me ask you this. COVID and the population we're talking about, older than, is it 65?
65 and older or eligible by disability.
Okay, the impact of COVID. Talk
Very
about
vulnerable population, right? So COVID's impacted in a couple of ways. One, it's just a deadly disease. And, I say it's like Russian roulette. You don't know if you're going to get the mild version or the really deadly version. And seniors and those with disabilities tend to be people with chronic conditions and likely to be more susceptible to serious illness. So it's been very difficult for them. And then you add the isolation and loneliness factor in there. And so we are trying to wrap our arms around this population during this difficult time.
Devil's advocate question. So Horizon is what it is. They are who they are. They cover a significant number of folks in New Jersey. What is the, dare I use the term advantage? What are the advantages of having the two largest health hospital systems in the state as part of this collaboration? What does that add to the ability to provide affordable, quality health insurance for those who need it?
I think that's a great question. Horizon has been collaborating with these and other providers for many, many years. And this is just sort of the next step in that collaboration where the closer that you can coordinate between payer and provider to make it as seamless as possible for those members, where your provider and your payer are not at odds with each other, but are absolutely in lockstep together to focus on the best for the members.
So let's play that again, payer and provider. I know I'm obsessing over terms.
No,
the provider of the healthcare would be a hospital or hospital system, right?
Or doctor,
the payer would be, in this case, Horizon.
Correct.
Are there other models across the country where providers and payers are coming together to do something like this with a company called whatever? Or is it the first ever like this?
No, there are others across the country that have done this. And what we found is where you have this level of collaboration, the quality of the care, the ability to offer really strong benefits, flexible benefits is greater because, again, of that collaboration and the fact that it is a value-based arrangement where all of our incentives are aligned.
What does that mean? All the incentives are what?
So we aren't, neither one of us is trying to make a profit on the other. We're working together to create, a comprehensive set of benefits and a comprehensive offering to the members.
And so let me ask you this. Healthcare often seems confusing, often seems unnecessarily complicated. But of course, when I ask about that, people say, well, it is. It is complicated. Well, is this a way, Luisa, if I can ask you this way, is it in any way to simplify a complex healthcare system?
It is absolutely the goal. The goal is to together try to simplify this complex beast called healthcare and to make it simpler for the doctors, simpler for the members, and make it more affordable for everybody.
And by the way, you mentioned for the doctors, I happen to do a lot of physician leadership work in my other life. And I know you've heard this in your professional life. Hearing physicians talk about how complicated it is to do what they do, I don't mean just clinically, but administratively. So that's part of the mix as well. I just want to be clear.
It is, in fact, one of the hallmarks of the Braven Health entity is we've created a provider council. We've brought together 14 physicians and office managers from across our 8-county area, both primary care doctors, specialists, administrators, large practices, small practices, not just those within Hackensack Meridian or Robert Wood Johnson Barnabas, but all through the community to bring their voice into what we do. And they're the closest to the patient. So not only, it's a twofer, not only do we get their voice, but we're also hearing from them what the patients are saying to them. So they can help advise us how to make things better, how to make things simpler, how to take the red tape out of this to the extent that that's possible. It's a big ask, but we're going to absolutely try our best to do that.
And we will continue to follow how things play out at Braven Health, not only for you, but, and respectfully, more importantly, for the people you serve every day. Luisa Charbonneau is CEO of Braven Health. I want to thank you for joining us. We appreciate it.
Thank you, Steve.
All the best. I'm Steve Adubato. Thank you so much for watching. We'll see you next time.
State of Affairs with Steve Adubato is a production of the Caucus Educational Corporation. Funding has been provided by PSE&G, the New Jersey Education Association, New Jersey Sharing Network, the Turrell Fund, supporting Reimagine Childcare, the Robert Wood Johnson Foundation, the Healthcare Foundation of New Jersey, NJM Insurance Group, Johnson & Johnson, and by IBEW Local 102. Promotional support provided by CIANJ and Commerce Magazine, and by New Jersey Monthly.
I could feel my lungs fill with oxygen, and I got my life back.
The Sharing Network means to me hope, life, and everything.
The Sharing Network was a lifeline to me when I really needed it.
We are an organ procurement organization.
The core purpose of the New Jersey Sharing Network is to save and enhance lives.
To honor those who gave.
Pay tribute to those who received.
Offer hope to those who continue to wait.
And remember the lives lost while waiting.
For the gift of life.